Welcome back. Now, scientists are hard at work trying to get a better understanding of the Omicron variant of COVID-19. The variant was detected in South Africa just last month, but it later on transpired that the Netherlands had discovered it a week earlier than South Africa. Now, Omicron is believed to be highly transmissible, and to get the latest on the variant, we're now joined by Juliet Pulliam from the SA Center of Epidemiological Modeling and Analysis. Juliet, thank you for your time and good morning to you. It's always somewhat fascinating to hear any progress or development around, the Omicron variant, because scientists had, beforehand told us that it's still early stages. We are still investigating and trying to understand it. And I'm just keen to know from you at this point, any development whatsoever that you can share with us about what this variant is and what it's capable of.
Sure. So I published a study about a week ago, that demonstrated that this virus, this variant, has an ability to evade the immune response in individuals who have had a prior infection. And subsequent studies have supported that finding in a number of ways. Primarily, laboratory studies have found that the virus is much more difficult to neutralize than previous variants in laboratory studies using blood from people who have either been previously infected or had vaccination.
Yeah, and I mean, I know the UK has also recorded its first death linked to the Omicron variant. What do we know about the variant and, of course, vaccine efficacy at this point with the vaccines that we have at our disposal?
At this point, we still don't know very much. It does seem that a lot of people who are vaccinated are getting infected, but it's still a little bit early to say how severe the disease is in these or in anyone else for that matter.
Right. And in terms of, symptoms associated to the variant, Julia, do we know how different the Omicron variant is to, other variants such as the Beta or even the Delta, just in terms of the, I suppose, the severity of what could happen should you contract this variant?
So I'm optimistic that people who have some form of prior immunity, either through vaccination or through natural infection, are going to turn out to have relatively mild disease. I think we're seeing a lot of signals of that. We don't have very robust data at this point, but I don't think we have any evidence yet about what the severity of disease will be in people who are unvaccinated and have not been previously infected.
Yeah, and I suppose those who are listening into our conversation want to know then, how do they, avoid, if it's even possible, the variant? How do they better take care of themselves? How do they make sure they're better, of course, healthy in terms of the variant, even should they contract it, of course, have a better chance of not experiencing those severe symptoms?
I think that the most important things that you can do are the same things that we've been saying all along. So wearing a mask, social distancing, avoiding large gatherings, and ventilation. Those are the best preventative measures we have. This virus does seem to transmit exceptionally well, and probably even more than Delta did, which of course was a highly transmissible variant. And so I think that many people will get infected, and that in that case, the main thing is to seek treatment early if you do start having severe symptoms.
No, and I suppose it's even more important to share that, right? Given that it's the holiday season, it's usually a season where people gather around in crowds. It's when people obviously have family and friends over for the festive season. So I can't emphasize that message even more around making sure that you're safe. But just in terms of the peak and the numbers that we're seeing and the variant being so transmissible, when do you think South Africa at least would see that particular peak? And when do you see the numbers actually then going down?
I expect that it will happen in the next week or possibly 2 weeks. I think that there has been a lot of confusion recently because of some issues with a security update that happened in the NHLS computer system, and that made the numbers appear to come down. But I think that that's not actually the case. That the numbers are still going up a little bit, but I expect that they will start coming down soon. Usually what happens is if the epidemic goes up very quickly, it will come down very quickly as well.
Yeah. I want to make highlight of this, piece of information in terms of a study, and I'm not sure if I'm pronouncing it correctly. Please correct me if I'm not, but the PHIRST-C, following household through time, finding that more than 60% of individuals had been infected, at least by the end of 2021, resulting in this highly high-level infection combined with 40% of coverage of vaccination among adults. I mean, are we seeing that the Omicron variant had been, obviously infecting a lot more households way probably before that we detected that this is obviously a new variant than the Beta and the Delta variant? What is the data showing us in terms of what could possibly have been, the timelines of the Omicron variant in the country?
Right. So I think that the first C study is an excellent study, but it actually predates the emergence of Omicron. And so the most recent data we have from that, I believe, is from the end of September. And the evidence suggests that that the variant started spreading most rapidly in mid-November. Although I think there's some evidence that it was probably around at a very low level before that, perhaps as early October. But that evidence is still very speculative, and I think that we will learn more as more samples are collected and better phylogenetic trees can be constructed.
Right. Well, Juliet, I appreciate your time this morning and speaking to us. Juliet Pulliam from the Center of Epidemiological Modeling and Analysis. Thank you for your time this morning.